Baker for me.
All right, well, since my mic's already hot, I'll just start talking. Good morning. Thank you so much for this opportunity. And I have some products that I would love to ask you to pass around to remind you about the service that we provide. I'll start these over here. These are pretty cool pens. They light up. Just FYI.
Janet's talking now. Over.
Okay, over.
I like that. Just good.
Thank you, Professor
This is
Toombs.
your little thing, and
Okay,
then
that's my
here's
clicker.
this means forward, and that's if you want to use your little,
Okay.
if you want to highlight. Either way, you're just good.
Good. Okay, thank you very much. This introduction was really perfect for what I've prepared for this morning's presentation. When Professor Toombs talks about the difference between products and services, I'm going to introduce to you what is a relatively unknown service that is highly utilized. And we're going to talk a little bit about the market demand and the size and growth of the industry of optometry. But I think first I'm going to introduce to you a little bit about what optometry is. There's a lot of confusion about two particular eye care related services, optometry and ophthalmology. So I'm going to start by defining terms so that we can understand that I represent the Oregon Optometric Physicians Association. And what the Optometric Physicians Association, we're America's family eye doctors. Upwards of 90% of primary eye care is delivered through optometrists, optometric physicians, doctors of optometry, or ODs. Those all mean the same thing, which is a little bit of a part of what maybe you can help me figure out in terms of branding, because we don't even know what to call ourselves.
I'll put these up for review. These are on Top Hat, and I'll put them up for review. I haven't clicked it. These will all be available for you, so you don't have to worry about it.
Okay. So what do ODs do? And that's the shortest way to describe it, so that's the term I'm going to use. Although, I will mention that the legal right to be called a physician or a doctor is part and parcel of what we do as an association, and that is the legislative advocacy work to go to the state and to ask for permission for laws to be allowed to do certain things. It doesn't matter for this class, but optometry is a legislated profession, which means that we have to go to the legislature and ask every time there's a new technology, a new opportunity, a new educational outcome that would change the quote-unquote scope of practice. So being able to call themselves doctors was one of those things that the optometric physicians had to go to the state legislature and get passed as a law. So they take it very seriously, and should, because it's something they work very hard for. So what do ODs do? They examine, diagnose, treat, manage diseases, injuries, and disorders of the visual system, the eye, and associated structures, as well as identify related systemic conditions affecting the eye. Catchy, huh? That's a pretty good brand, right? We can't even remember that stuff. That's where we need your help, is how do we boil this down to something that people can remember, when in fact they're using, I mean, I noticed so many of you have glasses on. You utilize our services, but probably don't even know who we are, right? So you can read, I'm not going to read the rest of that, but they prescribe medications. They can do everything, almost everything there is to do related to the eye, except for surgery, because that's the domain that medical doctors, ophthalmologists, MDs who have some specialty in the eye have legislatively kept optometrists from doing. So that is the singular domain of medical doctor ophthalmologists that differs from what optometrists can do. Professional education for ODs is pretty significant. It's remarkable to me how brilliant these doctors are. They have undergraduate degrees in usually some very significant science or math field, and then they go through an application process for a 4-year postgraduate degree in nothing but the study of the eye. So to me, if I'm going to choose between an optometrist and an ophthalmologist for my primary eye care, I'm going to choose an optometrist because that individual has studied nothing but the eye for 4 years in postgraduate education. Whereas an ophthalmologist, by virtue of having graduated from medical school, maybe spent a year in residency on the eye, but they can perform surgery on your eye. They got a general medical education, maybe a year on the eye, but they have a higher level of scope and practice than optometrists do, even though they're the ones who have studied it for 4 years. If you just glance at some of the technical aspects of what optometric students study, it's remarkable to me. I mean, I have a great deal of respect for the individuals for whom I work. It's a relatively small healthcare profession, but as I say, delivers most of the primary eye care in America. 40,000 ODs as compared to 700,000 MDs in the United States. There's a very significant piece of this that I'm going to come back on and focus on, and that is the number of communities served where only an optometrist provides the eye care there. There are more optometrists in rural areas than there are ophthalmologists. And here's just a chart of the difference between what doctors of optometry can do and what ophthalmologists can do. And as you can see, virtually the only thing that ODs cannot do is perform cataract surgery or other invasive surgery on the eye. But yet people have a perception that ophthalmologists are somehow better, smarter, should be seen as the specialists in the eye. And that's factually inaccurate, but that's one of the public perceptions that I would love your help with in terms of figuring out how to brand optometry in Oregon. Let's start in Oregon, and then let's go worldwide. In terms of access to primary eye care, these are two maps of Oregon. The left shows the number of counties covered with optometric physicians, and you can see the darker, it's too hard to see the legend, but you'll be able to when you have the slides yourselves, but obviously the darker is the I-5 corridor, and that's where you have the highest number of physicians. And there are only, and actually this left-hand map with optometric physician coverage is inaccurate because is that Wallowa County? Wallowa County, in the upper northeast corner of the state, actually does have an optometric physician, so that should be read as well. Whereas the, where's my pointer thing? You can see the lack of coverage for much of the state for ophthalmology. So again, there's a perceptual difference in terms of the brand between optometry and ophthalmology, and I would love your help with that. Okay, let's talk a little bit about the business aspect of optometry. It is big business. So we know that more than 3/4 of the adult population wears some kind of eye care correction product, whether it's contact lenses or eyeglasses. $33.5 billion spent annually by American adults for refractive eye exams. Refractive eye exams is what you do when you get a comprehensive eye exam, or a straight-ahead refraction is what a lot of substitute products and emerging technologies are providing through online eye tests. You may have heard of some of them, Alternative, Hubble Contacts, 1-800. There are a number of online programs now that tell you, and I have done this myself to test the system. Hold your iPhone between your eyes and your computer, and we will do an eye exam for you. That's literally impossible, but it's being done, and it's being outlawed in a number of states. But because it's online and pervasive and available everywhere, it's very hard for regulators to get their arms around.
Say that again?
Seriously, hold your iPhone in front of your computer.
Can we Google it right now?
Sure. Let's see what's a good one. Do alternative. And although they've changed their
Here,
name.
let's put it up. Here, what do you think? That's interesting.
Oh, it's a really big business that is very dangerous.
Oh, wait,
as a matter of fact.
I'll open it up. I'm gonna open this up.
Okay.
I'm gonna open this up for review, so.
In fact, and I will tell you a little bit about that while he's doing that. So I have done this twice. You can order, how many people have ordered contacts online? Anybody? Okay. You might not want to do that again. I'm going to share with you why. Contact lenses are federally regulated medical devices. They are the only medical device you put on the only exposed organ in the human body. There are more than 1 million visits to the emergency room every year in America due to improper hygiene for contact lenses, for contact lenses that are not the right prescription or the right oxygen content or the right curvature, the things that a licensed eye doctor, whether it's an ophthalmologist or an optometrist, will do in a comprehensive eye exam based on your individual eye health, your eye conditions, your vision, and any other systemic issues that you have going on. Just do online eye tests. Let's see how many there are.
Eye test. Free online, okay.
There you go.
Opta Plus.
Okay, see, I didn't even know about that one.
Yeah,
Okay, see, okay, is that, can you put that one
yeah,
up?
yeah, right here.
Okay, so see where it says here, allow the following distance between the subject and the screen. It's telling you that if you have a 20-inch screen, stand 7 feet away from it, and we can evaluate your eyes based on this chart.
I see. And that's bullshit.
It's total bullshit.
Okay.
Oh,
Okay, I'm sorry. I
Okay.
shouldn't even be here.
it's dangerous, and as I say, being outlawed in a number of states. Part of the reason it's dangerous is, as I mentioned, only on comprehensive eye exam with the training that I already outlined that ODs have, and the equipment that they have in their offices, can they see the back of the eye. You can't get that by looking at a screen, right? So by being able to examine the back of the eye, they can see the blood vessels, they can see, they diagnose hypertension, diabetes, heart problems, cancer, any number of things on comprehensive eye exam that you can never do on a screening, which we'll talk a little bit more about, but certainly not on your computer, okay? So that's a big thing. We can talk more about that later, but it is a very serious issue. And I would heartily recommend that you get a comprehensive eye exam and allow your eye doctor to prescribe contact lenses for you. There is no cost differential, by the way. Contacts are not a profit center for eye doctors. They do it truly because of patient care. So you can order them online. They're going to cost you the same as if you get them in the doctor's office. So, all right. $28.6 billion spent for medical and surgical eye care. That's a product or a service differentiation within the profession. That you have the vision exam, the comprehensive eye exam, whereby your eyeglasses are the result of a prescription provided by your eye doctor. But some of the other things that I mentioned, the hypertension, the diabetes, et cetera, as patients increase in age, other medical conditions that are discernible on exam are things like glaucoma and cataracts and age-related macular degeneration, et cetera. That's medical eye care. And from a business perspective, that's where our profession needs to go, because the profit margin is higher in terms of reimbursement rates for medical care than it is for vision exams. Total eye care demand per capita is about $200 a year. I think that's very low. If you've bought glasses lately, the price points have increased considerably. Higher demand in the fastest growing demographic. Over 40, the over 40 segment, it has much higher demand. As I kind of mentioned, that's where the onset of most ocular diseases, the age-related macular degeneration, the cataracts, the glaucoma, et cetera, that's the age where that demographically starts taking place at higher levels. And then the growth in demand is as a product or service is very predictable because we know what the population demographics are. Okay, what am I doing? Oh, there we go. Got it. All right, I'm not going to read through these, but some of the market trends in optometry, we know that the demand for corrective products has grown at a higher rate than GDP. It will continue to grow at a higher rate because of the increase in the age and population demographics. Emerging technologies, that's, as I mentioned, this is part of what's emerging technologies, but we have to be able to own the technology. Professor Toombs talked a little bit about some Airbnb versus hotels. That's an online app, right? It's a whole new business model. So is Uber. What do you call it? Ride sharing. Ride sharing, whether it's Uber, Lyft, whatever, right? That, if the taxi industry had owned that technology, had they thought futuristically about what their business model should be, they wouldn't be suffering now. If Kodak had anticipated digital imaging, Kodak wouldn't be a dinosaur. Does it even still exist? I don't know that it does.
We used it. What was an example? Yeah. No,
Yeah.
they're dead.
They're dead. So those kinds of Xerox, major, huge, room-sized copy machines that some of us are old enough to remember in the companies that we used to work for, are now replaced by all-in-one printers that you can buy at OfficeMax, right? So we need to figure out as a profession, as a very small but impactful healthcare profession, how do we own the technology? How do we own the access to consumer services for eye care and ensure that what people receive online is safe, quality eye care? How do we compartmentalize our services so that they can receive some of those services online but still get the important in-person comprehensive eye exams face-to-face? All right, so this is just a chart of that population shift that I mentioned, that we know that we're going to continue to, as people age, they're going to have a higher demand for eye care. But it's a bubble. If you look at it from the standpoint of baby boomers, we're capping out, right? You all are catching up. So we need to figure out, we should have figured this out 10 years ago. But maybe you all can help me figure out how to save the profession on the medical side. All right, so now I'm going to shift to Children's Vision in Oregon. And this is the project that Professor Toombs and I are hoping that you can help me with. It's really important. And from the standpoint, and I wrote this down because I thought this was really exactly what I'm looking for. The lifetime experiences, and he talked about Jeff Bezos and Amazon and building a customer for life. That's what this is. I need your help to figure out how we can build lifetime customers, lifetime patients, families of lifetime patients through Children's Vision. That's one issue. The other issue, quite frankly, is the public good issue. And that is the fact that Children's Vision, let me ask you this. Has everyone in here had a comprehensive, raise your hand if you've had a comprehensive eye exam from a licensed eye doctor in your life. Raise your hand high. Okay, so less than half of you. You are the statistic that I'm going to go through. That's what our issue is. We know that 1 in 5 children have vision problems that can interfere with their normal development, their reading proficiency, their classroom success, their social interactions, their self-esteem, athletic endeavors, and any number of other aspects of life. It is really important that children begin to get comprehensive eye exams before their first birthday. What we know about children's vision and pediatric vision at that youngest age is there's a condition called amblyopia. Have you ever seen a child that has one eye that looks like it's going a different, that's if it's going towards the center, that's called amblyopia. It is extremely treatable through patch therapy. Have you ever seen a kid that has, or have any of you even had patch therapy where they wear one patch? And that's to strengthen, actually you would think that that's on the bad eye. That's on the good eye. Because then that makes the other eye strengthen its muscles so that it can see, it can focus as needed. If caught early, it's completely treatable. If not caught, and the only reason it's not caught is because children don't get comprehensive eye exams. Most children don't get comprehensive eye exams. It is the #1 leading cause of blindness for people under 40. And then you're done. So what are the risks? What are the risks for ignoring children's vision? We know that 80% of learning by age 12 takes place visually, yet 86% of children don't get comprehensive eye exams. And 50% of students graduate high school with never having had a comprehensive eye exam. We also have a number of statistics that show that that is a predictor of future lifetime earnings. It's a predictor of incarceration rates. It's a predictor of lifetime success. And it's so easy, just get an eye exam. The cost of entry for this service that has a lifetime economic impact, I would love to have someone research, but it's a lifetime impact of lower earnings, higher incarceration rates. Once someone is incarcerated, their lifetime earnings is completely annihilated. And reading proficiency, by the way, did you know that the prison industrial complex uses third-grade reading proficiency to determine future prison building? Yeah. That's staggering. Let me repeat that. There is a whole industry of incarceration, which I hope you all are familiar with, that it is big business. Private prisons are huge business. And they use, their business model is to look at third-grade reading proficiency as a determinant of what the population will be that they can incarcerate and make money on. Talk about public good. To me, that's evil, but that's capitalism. So, and I already asked you how many of you have had comprehensive eye exams. I hope everyone out here will go out and do that, if you haven't. And if you haven't had one in a year, go do it again. You should be having them annually. Now let's talk a little bit about special education, ADD, ADHD. This is where our campaign is and where we hope that you will help us figure out how we can communicate this message to our target market. Children who do not receive comprehensive eye exams are far more likely to be diagnosed and treated for ADHD and special education. Why would that be?
Does everybody know what ADHD is? Okay, all right.
Attention deficit hyperactive disorder. Why would that be? Give me some ideas. Why do you think that would be? Having trouble focusing. Little Johnny can't focus, Mom and Dad. I think you need to take him to the pediatrician because he's got ADHD, says the teacher, with no health training, no eye training.
And maybe he can't focus.
He can't focus. But for me, as a teacher, that's a disruption to my classroom. Johnny can't focus. He's got a behavior problem. Little Johnny won't pay attention to what's going on the screen. He's scribbling. He's talking to his neighbor. He's a behavior problem for me as a teacher. So I call the parents in and I say, hey, we got an issue, I think he's got ADD, take him to the pediatrician. They take him to the pediatrician, they say, Mrs. Smith thinks Johnny has ADD. Oh, okay, well, let me have him read this chart at the end of my hallway, and if he passes that, then he probably does, here's a prescription for Ritalin. You better put him on an IEP. IEP, individualized
Talk about that
education
just a little.
program.
Explain that to the class, what that means.
So there are a number of programs within the category of special education. And there are federal acronyms that drive that don't matter. The point is that once that decision is made at the school level, that Johnny cannot pay attention in class, he needs some special accommodations. He needs longer to take tests. He needs to be sitting in the hallway so he doesn't disrupt other kids. He needs to go to the special education room because I need to be able to have my class focus, whatever it is. They then assemble a team of teacher, parents, school administrators, special education teachers. Oftentimes there are other counselors. Think of just the cost to the education system of assembling that team around an individual student. And they get in a room and they develop a plan for that kid to achieve the educational outcomes. Those educational outcomes, however, are lesser than what the rest of the class educational outcomes are. So you've already limited the learning trajectory of that kid. Okay?
Does everybody get that point?
Go ahead.
So I was just wondering, so what you're saying is that untreated eye problems are leading them to, like, are making like people develop ADHD, or?
No, they're being misdiagnosed
Alright.
by non-professionals, right?
And then they're being put in the pool.
They're being put in the IEP or the 504 plan or the special education classroom or whatever you want to call it. And we already know that the majority of kids are not getting comprehensive eye exams. What we also know is that 80% of children in special ed or on IEP plans have vision problems. Now, let me make sure you hear me.
That's important.
It's really important on that. Remember that only about 14% of children are getting comprehensive eye exams. So 86% of kids are not getting exams. Of those that go into, yes, sir?
Oh, no. And she's really nice. And I'm the sinister capitalist, of course, right? And she probably wouldn't say this, and I swore I wouldn't jump in, but I had to. And that is that and I know this for personal experience, is that when a child at a school is declared an IEP person, the school gets more funding.
Yes, that's
So
true.
there's a dirty incentive.
Yeah.
Now, we know everybody's an angel, right, in the capitalistic system. We know everybody, but there's an incentive to put these kids in IEP programs because the school gets more money. I'm sorry.
There is truth in that. However, think about where that money comes from. Go upstream. If the school is getting more money, where is that coming from? Taxes. Where's that coming from? The state budget, right? If the state budget is using money to fund individual education programs for children who don't need them, you're wasting my money, and that makes me mad. And it should make everybody mad, right? So, we know that that's happening. We know that 80% of children on IEPs have vision problems. So for crying out loud, that's just math. Figure it out, right? We also know that children in poverty, children of color, children with English as a second language experience a lack of access to care and a higher incident of being in special ed and IEPs than white children. So there's a social justice aspect to this that Chuck would never care about, but I do. So, And then I want to show you this, and I actually brought, I'm going to pass these around. I have developed these postcards that we've used to educate legislators who know nothing about any of this, and they're very busy people. You've got to realize they have thousands of bills in areas they know nothing about that they have to deal with. It's our job to teach them. Okay,
I'll send these.
Great.
You can talk. Keep talking.
So this is one of the postcards that I've developed, and I think that's a pretty critical one. In her lifetime, she'll get 160 dental checkups and 16 eye exams. Good question. Good question. Access to comprehensive eye exams cost should never be a barrier, and here's why. If you paid full price fee for service at a doctor's office with no insurance, which you would never do, it's probably $200 at the most, closer to 100. Okay? However, in Oregon, we have multiple programs that would make it far less than that, if not free. So children should never go without eye exams because there's a barrier related to cost. We have KEX Kids providers. We have the Oregon Foundation for Vision Awareness. We have the Oregon Health Plan, private insurance, any number of programs that are available.
But keep in mind, we're interested in the value of transmitting the value of good eyesight at the child. That's what we focus on. Not that that's not important, what you're saying. But.
Yeah.
Accessibility in getting that eye care, because it's not in the pediatrician's building, right? So they have to go to a separate location for it?
Yes. Pediatricians, as wonderful as they are not trained and don't have the equipment to deliver comprehensive eye exams in their offices. Okay, so moving on. All right, so, and I've already talked a little bit about this. Keeping children from getting comprehensive eye exams from age 1 on sets them up for a lifetime of diminished potential, and it's wrong, and it costs our society dearly. Because just as Professor Toombs talks about, we want to have a smart electorate, we want to have a smart society. Well, how are you going to do that if children aren't achieving their educational potential? And they're not getting that because they can't see. It's that simple, right? I mentioned the incarceration issue. 53% of incarcerated youth report having had IEPs, twice the rate of youth outside the justice system. 70 to 75%, or 75 to 90%, juvenile offenders have been diagnosed with learning disabilities. Again, there's a correlation between learning disabilities or diagnosed learning disabilities and vision. 70% of adult inmates have untreated vision and eye health problems. Okay, so let's think about the cost aspect of this for a minute. And that's what the left graphic is about, right? 80% of kids referred for special ed have vision problems, left untreated. The cost goes up to the schools and the public. Do you know how much it costs for a child to be on an IEP, an individual education program? Anybody? $10,000 to $50,000 per student per year. That's your money. That's my money. Okay? And we already established that a comprehensive eye exam and the corrective lenses to help them be able to reach their highest level of education potential, maybe $200. Economically, I can make this argument with legislators all day long that they should require all of Oregon's children to have comprehensive eye exams, period. I can make that argument economically. I can make that argument educationally, of course. I can make that argument from an incarceration standpoint. You know how much it costs to incarcerate someone in the state of Oregon?
Gotta be like 40 grand a year.
40 grand a year. Your money. Think about that. Help me figure out how to brand that it is smarter, cheaper, and a higher value proposition for every kid in Oregon to have a comprehensive eye exam by age 1, 3, and 5, and every other year thereafter, than it is for them to end up incarcerated, lower educational outcomes, lower lifetime earning potential. So we hear a lot about socioeconomic status as a predictor to educational outcomes, right? True. But why is that? Because children from lower socioeconomic family structures have lower access to care. They have lower access to health. They have lower access to healthy food. They have lower access. What is actually, though, a higher predictor, a better predictor of academic success? Socioeconomic status with all of those things, or vision? It's vision. And now let's talk about screenings. How many had school vision screenings growing up?
And that's like what you eat when you get your driver's license, that same thing?
Similar, yeah. It's when, like, the Lions Club comes to school in their yellow vests, the volunteers come and do the little vision screenings. Sometimes it's a chart on the wall. Sometimes they have something called the spot screener, and that is a great first step. The problem is that parents think, kids think, teachers think, doctors think, pediatricians think, oh, well, they had an eye exam at school. We have a branding problem. The public thinks a screening is the same as a comprehensive eye exam, and it's not. So help me figure out how to brand that. Okay? They miss upwards of 80% of the vision problems. Because what happens? Screenings only measure distance vision. Every one of you is sitting in front of a computer. Right? Being able to read a chart on the wall is no indicator of whether or not you can see your computer, see the notebook that you're taking notes in, or whether or not your eyes can maintain focus on that up-close work, which is where 80% of learning takes place. There's something called convergence insufficiency. Convergence, lack of ability to maintain convergence. Insufficiency, right? Screenings don't test that. Licensed eye doctors in their offices with their training and equipment can test that. And it's easily correctable. But it also leads to, well, you know what? Johnny is not paying attention. He can't focus. He's looking around. He's talking to Susie. He's got ADD. So that's another reason it's important for children to have comprehensive eye exams rather than just screenings. This, the postcard that, did you send those around? Oh.
Yeah.
Okay.
I had two of them out.
Okay, this one?
Oh, yes, I did.
You did that one? You got that one? Okay, take a look at that one. Think about that. A kid who reads like this passes school screenings. Children don't know that everybody doesn't see this way. They don't even have the language to say, is this the way I should be seeing this? Do you know what the number one comment, and some of you who wear glasses may even know what I'm talking about. The number one comment when people get their first eye exam and corrective lenses, oftentimes is, I had no idea there are actually leaves on those trees. Can any of you relate to that? It's not just a big green blob. There are individual leaves. Oh my gosh. So it's very important, again, because children can't articulate for us that they see in a different way. Because they know no different, and they don't have the language or the comparative ability to say, do you see the same way I do? So, very important. Okay, cost-benefit ratio for every child in Oregon having a comprehensive eye exam. The value proposition is undeniable. We've talked a little bit about that. I mentioned the cost of IEPs. The first two bullets I really would like you to pay attention to. The national economic burden of vision problems for children 17 and under is an estimated $5.7 billion annually. That's a lot of money. We always talk about education being so poorly funded from a public standpoint. We talk about higher education being so poorly funded, and it is in Oregon, right? How about we reallocate some of the failure cost money to investing in improving educational outcomes through Children's Vision? And I mentioned that cost and access should never be a problem. I showed you the maps. There are optometric physicians in every corner of this state. And I know them. I know these people. Even if they're not a part of one of these programs, they're not going to let a kid go untreated. They'll do it pro bono. They will work out a plan, whatever it takes. So, who's our market? Who's our market? Millennial moms, right? We know that in healthcare as well as in grocery shopping and any number of other consumer-based decisions, women make 95% of the decisions for a family, not just for herself, right?
Mine's 99.
Of course it is. Okay. So what's the product? What is our product? What is our product? So I actually wrote this down when Professor Toombs was talking about this. What is the product? It's very confusing for optometry. Optometry can't even figure out what its product is. It has like this 20-page narrative of what it wants to call its product and service. Help me figure out the catchy product brand that service. It's a service, not a product. But there are products. Corrective eyewear are products, right? But the access to those is through our service, through comprehensive eye exams. What's the product? I threw that out there, but maybe you can help me figure out a better, catchier, shorter product idea. What's the price? Well, should never be an issue for Children's Vision, as I mentioned. But the actual price point, again, if you paid fee for service, $200. Okay?
Does a normal health insurance program, normal, run-of-the-mill, corporate thing, pay for an exam like this?
Most of them do. Most employer insurance plans come along with a vision plan.
Yeah, it's cheaper now.
And the singular largest vision plan in this country is called VSP. Has anyone ever heard of VSP? Have VSP? VSP insures 70 million lives. That's almost a quarter of the country. Quarter. It's a third of the country. No. Do my math. It's a lot of people. So, yes, employers typically will use VSP. And then, of course, there's the Oregon Health Plan, which, at least at this point, unless the federal government changes the Affordable Care Act, it is an essential benefit, which means it's required for children 0 to 18 to have comprehensive eye exams and eyewear. So again, shouldn't be a cost issue. What's the place? We have about 1,500 eye doctors in Oregon when you include the optometric physicians and the ophthalmologists. Shouldn't be a problem to find an eye doctor. What's the problem? What's the problem? What's the promotion? That's your challenge. I need your help. Help me figure out how we get every kid in Oregon a comprehensive eye exam for all the reasons that we just talked about. When I wrote this, I actually typed out what's the promotion. I typed this out, and we can't use it, but I just thought it was really good. I wanted to say, don't you love your kids? Really, it's got to be, we've got to tug something at these millennial moms. Okay, well, I probably can't use that one, but yeah. So, questions? Anything I can answer for you before we, yes, sir?
What have you done and why it didn't work out?
What have we done and why hasn't it worked out?
I can help
We've
here.
overcomplicated.
I can help here a little bit, which is a reason why I like this project. And that is because unlike a lot of these associations that are trade associations, most of these trade associations have a national scope that drives everything. This has no national scope whatsoever. You've got 50 individual optometry associations all doing their own thing and no commonality between any of them. Now that's stupid number one, right? But we can't fix stupid, but we can fix Oregon. See?
Because we're smart.
See, we can fix Oregon, and that's the key. I think the answer to I asked the same question. The answer is that you would think this is a no-brainer. I mean, on its face, this looks like a no-brainer, and because it makes all the logical, rational sense in the world. And there's a disconnect, and the disconnect comes from a lot of these different areas we've been talking about. So what we want to do is we want to move in, and we want to be the Uber of this situation. We want to show up with the answer. Figure it out in Oregon. Figure the answer out. And next year, when she goes to her meeting, and they look at optometry visits, and they look at every other state in the United States, and they look at Oregon, and it's 300 times more, that will be our result.
That's right.
Because I asked the same thing. I said, this is bullshit. They should just have some campaign,
National ad
cancer
campaign,
societies.
right.
It doesn't work that way.
That's right. That's exactly right. And that's the primary issue. The other issue is that within the national structure, there is no marketing component. There's no marketing structure to do this. So they've outsourced it. There is something called Think About Your Eyes. And maybe you've seen commercials on TV or digital, et cetera, and now that you know, maybe you will. But its singular message is to get people to go get comprehensive eye exams. But it's not focused on kids. And I want to focus on kids in Oregon. Okay?
I've got a few slides of my own, and then we'll take a quick break, and then we'll get back together. I think that's a better way to do it. We may end a little later than 11:30 usual, but this is important too. We did it independent. Janet was over last night, so we tried to. But I've got some real opinions about this that I want to make sure that I get out right now. Not that I think that. I mean, you've got enough meat here to be able to put together a marketing program. There's no question that was really well done. The one I want to take a look at is this ADHD thing, because and I want to give you some statistics because I think it's important that you understand the average age that they diagnose these kids with. And ADHD didn't exist 20 years ago. It didn't exist. Matter of fact, in China, in China, it's just now. They're recognizing, or they're just creating. This didn't exist. So the age at which these things come out, about 3 to 6 year old, and about the numbers, there's numbers fly all over the place, but 6% of the children are being treated for ADHD with medication. That's about 6% of the population. It's pretty large if you think about it, 6% of the population. And what you find is that in richer school districts, they're being medicated at twice the rate of that. Why? Because they can afford it. Okay, and 42% increase in diagnosis over the last year. So this is an epidemic. If you look at it, just the numbers. Oh my God! This disease appeared 15 years ago, and it's taking over the world. Well, is it really taking over the world? You know, what is it going? And these kids, they have difficulty concentrating and focusing, staying organized. Janet talked a lot about that. Again, here's some statistics. Janet did most of these. 13% of men are diagnosed. Just 4% of women. There we go. Men we get screwed again, right? Men are just these guys that can't concentrate. You know, we're just stupid, right? 7 years old. 3 to 6, and it's not just a childhood disorder according to this. Now, I thought of a couple of children English speaking at 4 times the risk. You know, that's one of the males are at 3 times the risk. Here's the growth of the disease, right? the growth of the disease is really outpacing everything, a lot of things. So you wonder, as a skeptical person, you wonder what's going on here, what's really happening.
Chuck, can I interject something
Please.
on that, please?
Yeah,
So some of the work I previously did was around the epidemic of obesity in America. And one of the research studies that I came across during that time was if you look at we have systematically eliminated physical education from education, right? It used to be every day. Now kids are lucky if they get a 20-minute physical education session twice a week. We have, because of standardized testing, we have reduced outside recess activity, right? So there's less physical activity in children's lives at school. There's an inverse relationship between physical activity and ADD and ADHD. What we know is Ritalin, one dose of Ritalin is the equivalent, this is from research, to 30 minutes of physical activity. So it's not just vision that has yeah, and then there's the whole pharmaceutical marketing of Ritalin to doctors.
This is a timeline. It's hard to read, but this is a timeline of the whole history of ADHD and what's happening. And the fact of the matter is, if I would be skeptical normally, because I'm normally a skeptical guy, but I look at a disease that emerges, you know, it just emerged on the landscape as something that there's other things involved with this thing. And here's the other one I thought was interesting. The rates are the highest ADHD rates are in these states. And you go, what the hell? These states aren't different. There's Indiana. I don't know. I've been in Indiana. You know, they're normal people in Indiana. I don't see that. You know, here's the lowest rates: California, Hawaii. There's no commonality to it. And you know, I go, what?
Those states also have the lower incidences of obesity.
Okay.
It's physical activity related.
Okay, that's a good one. This is the cost of illness. Janet covered that. This is one I pulled out last week. This was an article in the South China Morning Post. I was interested in how ADHD in China and Asia is being understood and stuff like that. And there's a lag period that's going on. Of course, with a lot of things relative to what's going on in the U.S. versus with Asia. But in Asia now, they're now starting to recognize this, and they're starting to go after this in a similar fashion. I think that's pretty interesting. The one I want to do is this convergence in efficiency, because I've learned just about as much as you have with Janet right now, so we're all together on this. But this convergence insufficiency, I think, is an interesting one to look at as a sort of an area of focus, and that is that this is something where the kid, in no fault of his own, this is what he sees. You know, he can't focus, he can't see this stuff, and a normal eye test won't correct that. They can't figure that out with just a normal screening. That's right, I've got this here. With a normal screening, like you go in, so they'll just say, okay, Johnny, you can go into class, you're cool. Well, Johnny isn't cool. Johnny is far from cool. He's got this convergence insufficiency. But this thing is easy to fix. It's totally easy to fix. It can be fixed with the little patch thing or whatever. This is not like diabetes or something like this. This is a no-brainer. And then if you look at that and you think, okay, and these are the numbers that I'm throwing out because I'm a marketing guy and she may disagree, so that's why I'm going to say what I have to say. We'll take a break and then she can deny everything that I'm saying. But here's what I'm thinking. What I'm thinking is, I think the cases of ADHD are way overdiagnosed in the United States, and they will be in China in 10 years, because you guys always catch up. You just caught up with us with pollution, right? Now you're going to catch it. And I said that I think it's twice overdiagnosed, and I think that not only is it twice overdiagnosed, but the result of that overdiagnosis is to put these kids who have nothing less than this into a program where they're automatically at that age succumb to a lifetime of substandard behavior just because of that. That's it. In other words, Johnny, you go into room B, and Fred, you go into room A. And Fred, he gets the good teacher, he gets the stuff, he gets everything, and Johnny is the guy, well, we know you're not as good as everybody else. You know, we think, you know. And this is, if you look at the net present value of a human's life, and sentencing a kid just because he has that is an absolute joke. Now, what do I think is cool about this project? What I think is cool about this project is the fact that we have the technology, we have the skills, we have the mind power, and we have the resources from outside to bring in to affect major change. And the way my class is structured is we have groups that'll compete for this, and we'll have, you know, we'll celebrate the winners, and we will do this, but we will actually do one of the winning program. We will actually implement the winning program. And we will be able to see, with a relatively short period of time, this thing reversed in Oregon. And what will that do? That will make her famous.
And that's the goal.
And that's the goal, is to make her famous. And then means when she gets really rich, she'll give money back to Oregon State University. But in the meantime, that's the goal, is to make her famous and to come up with ideas. But to me, you know, and again, I don't want to talk too much because I don't want a project that just, you know, that repeats what I say, you know, because that's not learning. We want to learn going forward. But so those are my feelings on that. Now, I think we should take a 10-minute break, and then we'll close up class with a panel discussion with the class and everything. Okay? So everybody take 10 minutes, and then we'll reconvene. Is that all right? Yeah. Okay. Good.